Guys, once again, Ijaz Hidayat is with you with the new talk. Today, nowadays, we are talking about the medication used by the perfusionists during the cardiopulmonary bypass on the heart-lung machines. So today, we select a medicine is magnesium sulfate. So what is magnesium sulfate? Magnesium sulfate is a drug, is an anti-arrhythmic drug, which is going to improve your cardiac contractility, stabilize the repolarization of the heart muscles. It improves your myocardial protections. So what is the ideal dose for the usages of the magnesium sulfate on a heart lung machine used by the perfusionist? So as you know that the magnesium sulfate is a high alert medication, number one. So always prior to use the magnesium sulfate, you need to communicate with your cardiac anesthetist under the supervision of the cardiac anesthetist with the mutual understanding. You can use the magnesium sulfate on a heart-lung machine. So the magnesium sulfate, usually you will get it in a vials of 100 mils and in 100 mil, 10 mils. In a 10 mils of the vials, each mils containing 100 milligram. So 100 milligram per mils mean in 10 mils you having 1000 milligram mean 1 gram. So and if you having the 20 mils of the ampules, it will be like 2 grams. In 100 milligram per mils mean 2 grams. So what is the recommended dose for on a heart-lung machine for as a magnesium sulfates? As we know that the magnesium sulfate is going to improve the contractility of the heart muscles. It helps to stabilize the heart muscles. It helping to give a more better myocardial protection of the heart muscles, and it is anti-arrhythmic drugs. The time, as you know, we stop the heart on a heart-lung machine. We stop the heart with the help of with the chemical arrest called cardioplegia and with the hypothermia. So we stop the heart for a couple of hours, or we can say in 30 minutes or 60 minutes, or what I have actually the time. So heart muscles need some preservation. So magnesium sulfate is also preserving the heart muscles. So the recommendation dose of the heart muscle magnesium sulfate is 25 to 30 milligram per kg. So for example, if you have a 60 kg of the patients, so it's mean if the 60 kilogram patients going to multiply with the 60 into 30, you will get around something like a 1.6 or 1.5 grams required of the magnesium dose. So the dose, what is the ideal time to give a magnesium sulfate on a heart-lung machine? So especially the time when the surgeon will start to work on the internal memory, or the time of the rewarming, the time prior, at least 10 minutes before to releasing the aortic cross clamp, the time when the heart is arrested, you can give the dose of magnesium sulfate within 5 to 10 minutes. So don't give the magnesium like in a one push. So always give the dose with a slow push. So it will not going to affect your mean arterial pressure. You know the effect of the magnesium, so it's going to decrease your mean arterial pressure also. So also be very smart the time of you giving the magnesium sulfate with a slow dose, and it took around 5 to 10 minutes. And the once the rewarming started, you give the magnesium sulfate, and it will going to help the time you're going to release the cross clamp. So heart will get arrhythmia. It will prevent and it will reduce the arrhythmias with the magnesium sulfate. And magnesium sulfate also going to prevent a hypomagnesia. So guys, you can use magnesium sulfate. The ideal time is the time when you start rewarming the patient, the time when prior to 10 minutes to the cross clamp. So the dose of the magnesium sulfate is the different center have the different experiences. The ideal dose is in between 25 to 50 milligram per kg. So ideally in adult cases we are using 2 grams of magnesium sulfate prior to releasing the cross clamp on a heart-lung machines. Hope it is clear. Have a nice and good day. Take care. Bye bye.